Congratulations, you did it. Medical school done, residency done. And yet, somehow, instead of feeling super duper proud, your brain is telling you that you have no idea what's going on and that everyone around you is way more confident, way more competent than you are. Here's the thing, that's not a you problem. That's just your brain doing what brains do. You spent years getting every gold star, and now you're a beginner again. Of course it feels awful, but before you start to spiral, I want you to learn how to ask yourself this one question. What am I forgetting to remember? That's what we're digging into today. Hey everyone, welcome back to Stress RX. I'm Dr. Michelle Chestovich. I'm a family physician, a certified life coach, and I remember exactly what it's like to show up for work wondering if today's the day that everyone finds out that I really don't belong here, that I really have no idea what's going on. Today's episode is for you if you just finished medical school and you're heading off to residency. Maybe you just finished residency and you're starting your first real job. Both these moments are huge leaps, both incredibly common times for the imposter syndrome to show up loud and clear. So that's what we're going to be talking about today. Why your brain is freaking out, why it's completely normal, and what to do about it so you can actually enjoy this next chapter that you've been working so hard for. So let's get into it. Today, I'm going to share with you 3 strategies that's going to help calm down the imposter voice in your head. The first thing that I want to teach you is something called the rear view mirror check. What does that mean? Well, your brain defaults to everything it doesn't know. And what I want you to do is learn how to pause and realize, oh, my brain is seeing all the things that I don't know yet, and make it look in the rearview mirror. Wait a minute. How far have you come? Remember, you got into medical school. You did all of the things in, high school and undergrad, and you got in there. Remember that? And you learned anatomy. Do you remember when we didn't even know who Netter was? Right? I joked that I had an affair with Netter during that semester because I spent so much time with Netter studying over and over again. Remember? You memorized the Krebs cycle one more ding-dang time. Yes. Look how far you've come. Remember when we didn't know how to even use the stethoscope or use those crazy tuning forks? Do people use those, by the way? You have come so far. And when we look ahead, of course, we see all of that is in front of us, but it's good to pause every now and then and see how far you've come. Where you are right now, there's some high school kid, some college kid who is dreaming to be where you are. Now, again, that doesn't make everything all perfect, but it helps you see, wow, look how far I've come. Take a moment and appreciate that. There is evidence that you belong already. Your brain just isn't showing it to you because our brains are wired for negativity and it's going to see the gap. I want you to look backwards and see the gain. The second thing that I want you to do is catch the comparison trap. I mean, evolutionarily, it makes sense that we look around and see who our competition is and do we fit into the tribe or not? But when we are comparing ourselves as an intern to the senior resident, or worse, the attending, you are thinking, I should be there. Do you know why you're not there and why you shouldn't be there? Because you're an intern. That's why we have residencies after all. So when we compare, I want to be like that. And I totally wanted to leap ahead. When I was an intern and I didn't know what the hell I was doing, I didn't even know how to write frickin' orders. I so wanted to be in my 3rd year of residency, because I then wanted to just gain the confidence. Here's what I'll tell you. You got to go through the suck, but you can make it easier by not freaking yourself out, thinking you should already be there. Here's what I'll tell you. There will always be more to learn. And if you're always comparing yourself to someone who's ahead of you or has written more books than you or has written more articles or done more research, you're always going to be in the same damn position. Ask me how I know. As a physician coach for the last 5 years, I have had the privilege to coach lots of different people who are early in practice, people who have been years out and have been doing research, and who are chairs of their department. And you know what? If they have not trained their brain yet to do this work, they're continually comparing, and they're miserable, and they're stressed out all the time. So I'm glad that you're listening now and can start to realize, oh, here my brain is comparing again. Nothing's gone wrong, but wait a minute. This is where I'm supposed to be right now. This is why it's the practice of medicine. There will always be learning to do. Yes, you do become more confident the more reps you put in, but don't compare your first month to someone's third year. This is where I love to share the story about the eye doctors. Now, of course, we love the eye doctors. My grandfather was an ophthalmologist, and I tried to convince myself to go into ophthalmology, but it wasn't for me. I digress. That being said, the eye, okay? When things get really tough and you think, oh my God, I should be knowing all the things, do this. This is an eye. I will remind you, there is a front of the eye doctor and a back of the eye doctor. The retinal doctor, the back of the eye doctor, wants nothing to do with the cornea. Now, of course, I know that there are general amazing ophthalmologists who take care of the entire eye, but the specialist, there's a retinal specialist, a corneal specialist. So, folks, when you think, oh my God, I need to know it all, and we in family medicine often think because we learn it all, we need to know it all. Right now, today, right, we need to help every patient, all of the things, all of the time. I love to remind people about the eye. There's a front of the eye doctor and the back of the eye doctor. You're never going to know all the things about medicine, and even the eye doctors divide it up. I love that. If that helps you, please share that widely. It's something I love to remind myself. Finally, my favorite question to have you ask yourself when your brain is screaming at you at this imposterism of you don't belong, you don't know everything, someone's going to find out. I want you to ask yourself this question. What am I forgetting to remember? Similar to the first strategy about looking in the rearview mirror. But look, what am I forgetting to remember? What's your brain going to tell you? Oh, of course I don't know it all. This is why I'm in my training. Or if you're a new attending, of course I don't know as much as my partner who has been doing this for 20 years. I am learning. Right? What am I forgetting to remember? I am learning. This is the practice of medicine. I will always be learning. And let's be realistic. We're never going to know it all. But we're used to getting the gold stars, the A's, the 99% out of 100, and then we feel real confident. Oh, I know everything. But it's a lie. And so instead of believing, oh, you don't know everything, ask yourself that good question. What am I forgetting to remember? The other really cool thing is that you can even just acknowledge to yourself, I'm not a fraud because I want to learn more and do a really good job for my patients, right? Remember Fletch when Chevy Chase came in and pretended he was a doctor, and there's that little episode where they're like, doctor, doctor, doctor. He did not know what he was doing. You know what you're doing, and that's why you're having those thoughts and those feelings of doubt. That makes sense because you're learning, and that helps you learn and study and create a really good differential for your patients. That's going to help your patients. So what am I forgetting to remember? I belong here. Of course I don't know it all. I'm going to keep learning, and I know where to go for help. That's so helpful, whether you've been in practice for 5 years, 10 years, or if it's your first day of internship coming up on July 1st, you know where to go for help. You can always phone a friend. You can look something up on UpToDate, Open Evidence. There's so many places. You can grab someone who's sitting in the work area on the hospital floor. I've done that so many times. People are there to help you, and of course you're not supposed to know it all. So that's what I want you to do, is ask yourself, what am I forgetting to remember? I'm taking really good care of my patients. Having a little bit of doubt helps me really extend and ask for help and, create a really good differential. All of those things are beneficial to me and to my current patients as well as my future patients. This is such a good pattern interrupt when your brain starts spiraling. I don't belong. Everybody knows more than me. And I would love for you to ask that question out loud and maybe write it down. Maybe you just write, I went to medical school, or I finished residency. I know how to get help. I know how to go look for the answer. I've done hard things before. Because of course, we are always going to be learning. Medicine is a practice. There's not a time when we arrive. Now, certainly, over time, you do build more confidence. You've experienced lots of different things. You have confidence, but we will always be learning. And what I love for you, try this exercise. I love sharing this with my clients, is at the end of every day, to build that confidence, look in the mirror and say a couple of things that are true. Number one, I didn't know it all today, and I didn't finish all of the things, and I helped a lot of people today. When you start to fan that flame of confidence, when you hear those voices of doubt and imposterism, you're more readily able to let them go by like clouds in the sky. Oh, here I am having doubt again. Here I am thinking I don't belong. Because none of that is true. You are an amazing physician and you know how to do hard things. And there are days that are really uncomfortable, particularly when we're starting out in something new. We're used to being the high achievers and being the best at a lot of different things. So when we start out, we're beginners. I don't love that. I still don't love that. Even after all these years of coaching, I have to remind myself again on the regular, it's okay. You're learning. You will always be learning. Nothing's gone wrong here. That is the wisdom I have for you today, my dear friends. You belong. You are not a fraud. And ask yourself that really good question. What am I forgetting to remember? Until next week, peace and love to all of you.